Hi, everyone. My name is Laura Derry, and I'm a current third-year resident at UCSF. I'm part of the Health Systems Leadership, or HSL pathway, which I've been part of since my second year in residency. The HSL pathway is one of the pathways available to second and third year residents. The HSL pathway is really a pathway for those who have experience in health systems leadership or health systems, for folks who have no background in those areas and are really interested in learning more. For this pathway, most of our focus is around quality improvement and policy projects. So our teams have worked on projects each year in one of those two domains. Last year, our project was with one of the administrators at Covered California and with the Covered California team. Covered California, for those of you who are not familiar with the organization, is the health insurance marketplace for California for folks who are purchasing health insurance on the available marketplace, not through an employer. Covered California serves a large number of Californians, both families and individuals. So it was a really interesting project for us to get involved in as individuals who are providing care for folks with these health insurance plans. For Covered California, we were asked to help them better understand their quality on the marketplace. So, for example, there are a number of different quality metrics that are used across the US and in California to measure the quality of care delivered in hospitals as well as in physician offices. Most of the data is available for hospitals, as many of you might know, and most of this data comes through the Centers for Medicare and Medicaid Services, or CMS. Other reporting entities include Leapfrog and the US News and World Report. For our team, what we did is we looked across all of the publicly reported data, for example, CMS Hospital Compare and CMS databases, as well as proprietary databases that Covered California had. We really drilled down to understand the different metrics that were available to both the public as well as to Covered California in measuring and understanding quality at different hospital systems. And then we took those measures and we determined which ones we felt were most relevant for Covered California to help make decisions in their marketplace. For example, to decide which products or insurance packages should be available in the marketplace and those that may not be as high value. We did two things for the project and for Covered California. The first of which is we developed a dashboard to visualize the quality metrics and the various products that were available on Covered California's marketplace. So to allow them to easily compare across products and make decisions to influence their contracting decisions in the future, as well as better understand the quality of care that was provided through their marketplace. The second piece was really a white paper or a knowledge document on all of the really important and numerous quality metrics that are available. What we did with that is we really drilled down, as I previously mentioned, performed a landscape analysis of all of the quality metrics, and then identified the strengths and limitations of each of the different metrics and summarized those findings for the Covered California team, both to help them understand which metrics may be most informative for their marketplace, but also understand some of the gaps in the current quality measurement and metrics that are available to help inform future data decisions for their team. This was a really rich project for our team. Many of us had no background in this quality reporting and quality measurement area. So we learned a lot from Alice Chan, or Dr. Alice Chan, who's at the San Francisco General Hospital and serves in a leadership position at Covered California. We also had the opportunity to work with their team, really pulling and culling through the data to better understand what was important for them. And then lastly, we presented our work at one of the symposiums at UCSF, which is a great opportunity to share the work that HSL is doing as a team. So this project was really informative and helpful in many ways for those of us who are in HSL. It was really also a great opportunity for us to learn how to scope a project, how to really manage a project through its entire life cycle, and then present the final deliverables to clients, which I think are really important skills for anyone who is doing research, quality improvement, health systems improvement projects within a system or outside of a system. It's been a rich learning environment for HSL outside the project area as well. We have great speaker series that augment our learning on the project teams and excellent mentorship through Dr. Edgar Pierluisi, who is our faculty mentor. I'd be happy to share more about HSL and our projects if you have additional questions. Thanks so much.